Hello everyone, this is Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis. And in this video, I want to help you get better sleep. So I'm going to go over 5 habits for better sleep. This is something that many patients struggle with, many people out there. I'm sure you're struggling with getting good, high quality sleep. I've struggled with this in the past as well. So I'm going to talk about 5 habits that I help with patients, and some of these habits I do routinely myself to help me get a better night's sleep. So why is sleep important? Let's talk about that really quickly. You know, a lot of patients are like, well, you know what, I'm okay with just, 4 to 5 hours. That's all I've done my whole life, and that seems fine for me. Well, here's what the research shows. If you look into and you dig into the research, it shows that less than 7 hours, when you're getting less than 7 hours of sleep, and this is high quality sleep, and that's the other thing you got to think about. You may be in the bed for 7 hours, but are actually getting sleep for 7 hours? Probably not. So actually less than 7 hours of sleep has been correlated with an increased risk in type 2 diabetes, cancer, Alzheimer's, dementia, and obesity. So if we want to reduce our risk of these chronic diseases, then we want to make sure we're getting high quality sleep, and we want to make sure we're getting more than 7 hours of sleep. So let's talk about how we're going to do that. So it all starts with habits, right? So we need to create a routine and habit that is going to help us get better sleep. So let's talk about the first thing I want to talk about is increasing activity. So activity level is important. What I notice is that when my activity level is high during the day and I'm getting a good amount of activity, I definitely sleep better. So one of the things I do is I track my activity level during the day. You know, there's all these devices out there that will allow you to do that. And so one thing I've correlated and I've looked at, and this is what the research shows as well, is that when you have a good activity level, you do sleep better. Number 2, let's talk about the second routine, and that is eliminating alcohol and caffeine. So alcohol at night is definitely going to interfere with a good night's sleep. Of course, caffeine, some patients, caffeine does not have a big effect on them, but others it will. Even if the caffeine intake is in the morning, it can affect that night's sleep. So my recommendation is, and the habit I would recommend, is getting into no alcohol, no caffeine, and see if that improves your sleep. Number 3, let's talk about the third habit is getting sunlight. So being outside, getting some sunlight during the day. So that's going to help, of course, improve and increase your vitamin D levels. It also affects other hormones, and it helps you sleep better at night when you're out and getting that sunlight during the day. So get outdoors, get some sunlight. If you're in an environment where it's winter, you're not getting much sun, then you may want to take a look at getting a light for indoors, where you can actually recreate the sun indoors during the winter months. Number 4, eliminate blue light before bed. So we're all connected to these devices, whether it is a laptop, whether it is your cell phone, these smartphones, they're attached to us, or your tablet. So these all give off blue light, and your TV as well. So if you're watching TV before bed, that's also emitting blue light. So you got a couple options. You can get blue light blocking glasses. That is an option to help minimize the blue light. And another option is some of these devices, they do have a setting in them where you can actually hit that setting. It'll eliminate or minimize blue light. So why is that important? Because that blue light is going to stimulate, once again, we're talking about different hormones, and it's basically telling your brain that it is daylight and it's daytime and that you should be up, and therefore your body is not going to produce what it needs to get you to sleep. So you've all probably heard of melatonin, but there's other impact on other areas in the body that are being affected by this blue light. So My suggestion is eliminating the blue light before bed. I know it's tough to do. If you're going to be on your phone, if you're going to be on your tablet, then maybe it's investing in some blue light blockers, looking on your device, see if it has a setting. Maybe you want to incorporate both just to see how that affects your sleep, and keep that routine in for a number of weeks to see how it affects your body. All right, number 5, don't watch or read the news prior to bed. So what is typically broadcast all over the news? It's a lot of bad things, right? It's a lot of things that you shouldn't go to bed after watching, and it's hard to get to bed after watching. They're talking about, this conflict here or this problem there, in the world. So it stimulates a response in the body, and it can release your stress hormone. So cortisol, it's released by the adrenal gland. So this is one of those stress hormones which should be low at night when you're trying to go to bed. So it should be, melatonin should be higher and cortisol should be on the lower stage when you're trying to go to sleep. But if you're stimulated by bad news, whether that's watching the news, or maybe you're talking to a family member and maybe that family member starts to interbulate you some and stimulates that stress response, well, that's going to affect your ability to get to sleep and possibly stay to sleep. So my suggestion is getting into a routine where you're not watching, you're not reading, you're just trying to minimize and eliminate any bad news before going to bed. All right? So those are my 5 suggestions. Those are easy to incorporate. Incorporate those for 4 weeks. See how it affects you. Once again, if you have, there's different devices out there that track your sleep. You can see, what kind of sleep are you getting, whether it's deep sleep, light sleep. Are you getting into REM? How long are you getting into REM? How long are you in deep sleep, light sleep? It'll calculate and show you all of that. And then, incorporate these habits and see how it changes and see how it improves. And then see how what that's going to translate to. It's going to translate to better health, number 1. Reduce your risk of these chronic diseases that we talked about in the beginning. And it's going to give you're going to feel more refreshed during the day. You're going to feel more energized during the day. And that's going to benefit you because you're going to be more productive during the day. All right, guys. So I hope you got some great information from this video, and I will see you in the next one.